Good evening, dear viewers, and welcome to another episode of Health Link, brought to you in the studios of QTV by myself, Dr. Shamila Jha. And today we are going to have a co-host that maybe you have not seen before. I will introduce him soon. We have a lot of, in the country cases of COVID-19, and we have been very busy. Everybody in the health sector and also the partners, everybody has been busy to prevent new cases and also to give the optimal care to those that are infected. Now, we have two experts here that will be answering our questions and concerns that we may all have at this particular time. I know we understand that it is not everybody is anxious, and there may be a lot of questions that are running through your mind, and so we'll be opening the lines very soon. We will have translations in both Mandinka and in Wolof. Let me introduce you to my co-host today. He is Dr. Masarendin Njai. He is actually one of our doctors here, one of our brilliant doctors here, and previously he has taken part in the Ebola preparedness, and this time around he's taking part in the COVID-19 response. Welcome, Dr. Njai, to this program, and thank you for hosting this with me. Maybe you can also welcome our Wolof viewers and our Mandinka viewers.
Okay, mbali wonde mo be kontonna membe la moy kan moy be damento ani be wato mento nyin tembola bi fana natale nyan janne pour nale kacha menkete la health check tokti pour nale kacha nyin sasa membe keri ka fo me covid-19 ning ala sonta be line ol yella mol se kol ke nyin karol ke be nyin karol be katara pour ke jabi suñ bokki dokilikati olofi ñu ngi la nuyu fi from QTV. Tey nag dañ ñëw pour waxtaan ak yéen parce que jàngoro bu nekk ñëpp dégg nañ ko mooy COVID-19 so dinañ ñëw di waxtaan ak yéen nañ pare pour answer seen question yi ku am laajte mun ngaa laajte nañ try pour waxtaan ak yow ni ñu ko mën a defee jërëjëf.
Thank you very much, Dr. Njai. So our guest here, he's not a guest actually, maybe he should be my co-host again. Is Dr. Desta Tirune. The WHO country representative. I want to really express our gratitude, Dr. Desta, because I know at this particular time you are extremely busy, and you still have time to come and listen to our viewers and answer some of their questions. We really appreciate what you are doing for us. So, Dr. Desta, I have a little bit of a concern here. When I go around in the streets, as you know, we all have positive cases of COVID-19 in the country. I see a lot of gatherings. I see people in the beach. I see children playing football. It's a little bit of concern, Dr. Desta. I don't know what you think about this and what your advice is for us.
Okay. Thank you very much, first of all, for inviting me again to this studio, and I'm very happy to be here and respond to the queries that may arise from the public. It's a good question. It's a concern that everybody is actually observing every day, and government has stopped public gathering for a reason, because the moment you come together, you are likely to touch each other, and in close proximity, that's how the disease gets transmitted. That's why government banned public gathering and also requested students to stay at home. And this is with the assumption that everybody will be staying at home and will limit involvement with other people by staying at home. But what we see in the streets all along, people gathering together and sitting and chatting, is very, very risky.
Okay.
At this time, when we are having a few cases of coronavirus, these are just the symptoms of what we could have even. We could have a bigger problem. And the moment you have a case, there could be other contacts who might be in the community that may not have yet shown the symptoms of the disease. So that's the reason actually government took this decision for people to stay at home, students to stay at home. So people have to observe this strictly. The minimum distance that you always have to keep is 2 steps from anybody next to you. 2 steps.
I think we are doing that, isn't it? Now we are
step.
so far apart.
Yeah, this is an example of also the way we are sitting.
Physical
We
distancing.
should never be close to each other, because the moment you are 1 meter away, anything that comes from your mouth or when you sneeze or even when you talk will be falling before it reach 1 meter.
Okay.
So you will be actually avoiding any potential infectious material that will be coming out of this, which we call droplets. Technically. Which means these are small watery drops that will come out of our mouth and nose and maybe staying in the floor and wherever they are landing.
Yeah.
But if you at least keep that distance, you will avoid a lot of problems.
Okay.
In addition, washing hands, which is a magic,
Yes.
which is easy to do, but people are talking about water problem and so on, but there is water always, for something we have to use. We cannot survive without water. We have to afford to wash with water and soap as much as possible, and not touch also our face, particularly eyes, nose and mouth. These are how the virus is getting transmitted. So we have to avoid that. And the physical distancing, the washing, not touching the face, and getting also information which is reliable from the right source. If you also develop symptoms that look like flu, don't go to health facilities.
Yes.
Please call the toll-free number, which is, you don't get charged for that. It's 1025. Call 1025, but never go to the facility by yourself when you have symptoms. The symptoms are just like flu. You have fever, cough, or sore throat, or anything that looks like common cold, which you usually know. If you have these symptoms, you have to report. In the past, we are used to say that if you have traveled to places where there is a case, but now we have cases in the Gambia.
That's true.
So we don't know who is in contact with who. So for that reason, anybody who has these symptoms, they should actually call this number, get guidance from the health professionals on what to do and how to do it. This is my serious advice.
Okay.
So the soccer fields or naming ceremonies, going to religious activities should be actually, we have to just abandon those for the time being. It's for the safety of the public. The moment you interact with other people, the chance of you getting infection is very high. So people have to be very careful on this.
Thank you very much. I think that is very clear and very useful advice for us at this particular point in time. Dr. Njai, maybe can translate that for our viewers, because it's extremely useful.
Allah barka bake na bag dinda lamor lalu na WHO country representative yo le nyininka ja nyininka ro le nyindiko bawo nyin sasa fala be sialim banko kan sain and mol bita kan dulal to bichol to la kotengol to mol be bennaje ana la jabiro menti wala nyintiko mol nyanta katala nga jamfanyola asa doya nyawanyana ninga simfanya fula bula nyote ma wato wati ba niyo bula moti ma hanati sote ka wala totota janabe futale tema don o fengol ka jolom banko tole ani yamaro fanandi niaje man sakunda ya kata purka nyin kafunyolo tala wala nyintin na nyin kulyol na gamol ni na Quran karangol ani na fenkolo kulyol ni fudusi tolo niaje obe ka purka nyin sasa nyin ka janjango ka traya control parce que ni moke ni sasa rafa janjan tamina kala problem te banko kan wo kamala même fana lawo kan wala nyinti ko nga kata nga jamfanyola bake bawo ni moma ton ina suta nyola pour ka nyoma wo sembo sonata ba kan dale nyoma ite sembo ma no ye bulo ta ye dama ye nungoma ye nyama ite ta kalam telefon nu kata do isa sasa nyi sotono andu ni nga kata fo nga jamfanyola nga obe ke to ni ala sonta ala ben tankala nyim problème wala ay nyim fana laje ko nga kata man sa kunna ko mom fo nga bulanom so mbe laje ko ni ajube hani Supreme Islamic Council announcement o kele ka foko moli akata nga jaman total bla bawni tala jamol ton ka sutiya nyon nga kibarol falan so ka foko hani maka fanto yela jaman bañi sorone oto kamala be nyanta ka fulo nyomale nga jube narta islamo la karola rem ba islamo ko ngam fantanka ala fane nan tanka oto kala fende de mi alon ka kumata ba ka mi alon ko pour nga nyode maje suñ mbokki déglukat yi olof yi luñ doon waxtaan rek mooy dañ doon laajte WHO representative bi comme nit yi yaa ngi bari ñu ngi génn fu nekk te feebar bi fu nekk ni dugg na already nit yaa ngi génn di dem fu nekk so lu mu doon wax mooy ñu try ñu avoid loolu bu baax a baax parce que soo xoolee léegi feebar bi ñëw na fi woon dañ daan wax ne su nekkee ne da nga tukki woon dem feneen dëkk boo xam ne mu ngi fa waaye léegi fu ñu nekk ne mu ngi si dëkk bi so si kaw loolu mooy ne ñu try ñu avoid distance bi moo tax government ñu ne léegi fu ñu nekk ni bu ñu def gaadana yu bari mooy ngénte yi suñ jàng alxuraan yi gàmmoo yi yëpp ñu bàyyi ko tëj nañ school bi pour xale itam nekk si kër bi loolu yëpp pour make sure ne buñ try di jegenante waaye xale itam bu ñu nekkee ñu bàyyi leen pour ñu toog si kër bi nekku ne dañu war a bàyyi ñu dem fu nekk loolu itam dañ war a taa ñu waxtaan si loolu so wax naa ne tamit koo xam ne léegi da nga feebar comme nga am feebar yi sa purux di métti sa yaram bi di tànga ngay saxat mu ne bul dem si lopitaan bi demal nga call 1025 so ñooñu dañ na advice so su boobaa ñu try yëpp ñu déglu lu ñoo waxtaan pour aar suñ boppa si dëkk bi loolu lañ doon waxtaanee nii.
Thank you very much, Dr. Njie. Thank you so much. I think viewers will be opening the lines. You can call us on 5050505. The number will be appearing on the screen very soon. So we are here to answer your questions. We are talking about coronavirus and ways of preventing ourselves. We have here in the studio here Dr. Desta Tirune, WHO country representative, and Dr. Masarendin Njie. So the lines are open now and you can call. But Dr. Desta, we now that we have positive cases, we also have contacts that have come into contact with these positive cases that have been also followed up. And then we also have those that have been quarantined, those that have come from countries, like you said, in the previously where there were high hotspot countries. So there are like three different interventions been taking place, taking care of the people that are sick, taking care of their, following up their contacts, and also the quarantine. So I just wanted to get a little bit clear on what exactly is quarantine, what is expected of a person that is being quarantined. If you can maybe help us with that, yes.
Okay, thank you very much. What we are talking about when we say quarantine is isolating people who might be potentially infected. Possibly they may be exposed.
Okay.
Because the people who are under quarantine now in the Gambia are people who are coming from countries where the transmission of this disease is very high.
Okay.
So we don't know whether they have been in contact with anybody who is infected. So they are potential source of infection for the country. So that's why they are kept for 14 days.
14 days.
14
wow.
days is the maximum period that the symptom may not manifest. But if the person is fine for the 14 days, then it means they are not exposed to the virus.
Okay.
So they are free, then they will be going back to their homes.
Okay.
But for the 14 days, they should be separated from the public so that in case they are infected, they will be remaining isolated. And when we say also quarantine, isolated means that they are not interacting with each other in the facility. They should stay alone. They should limit their interaction with other people, and they will be staying within their rooms. They will be taking care of the cleaning of their rooms and even washing their own items. And they will be given food and other supplies that they need in their own rooms. So they don't move around for the 14 days. This is for the sake of limiting transmission. And if we do that, if everybody is cooperating and doing this correctly, then we will stop the possibility of transmission of the disease to other people, and we protect the Gambian public. One thing that I forgot to mention earlier about public gathering is actually I want to appeal to parents and guardians to keep their kids, the students, the children at home.
At home, okay.
Even with your neighbors. They should not interact with the children from the neighborhood.
Okay.
You should be alone
caller now.
in their own premises.
Okay.
Thanks.
We have a caller. Hello, caller.
Yes, hello.
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 Hello. Yes, we can hear you.
Yes, I must say thank you so much for your wonderful... Hello?
Hello,
Yes.
we can hear you, please, sir. Go on.
Yes, I must say thank you so much for that wonderful program, sensitizing people at this critical moment.
Okay.
But my concern here is, Hello, can you hear
Hello,
me?
yes, sir. Please go on. We can hear you.
My concern here is, okay, we're talking about the distance,
Yes.
which is very important, that we should create a distance of like at least 2 meters or 1 meter, in order to prevent ourselves from this pandemic, corona, all right? But if you get to the market, it is as if people don't care about it. Everybody is just, people are shaking hands, people get so close to each other here and there.
Yeah.
But I think now, okay, you guys are doing your quarter in sensitizing people, but the government should look at this thing critically. At least, can the government give 2 days announcement to say, okay, we're going to lock down everywhere, so that this corona case can be followed up, people can know what to do. But if it is like this, it is very scary. Okay, I was thinking, like, when the government says lockdown, it's going to be like everywhere. But it is so sad that it's only the essential workers. And even the essential workers, the letter that I saw, is like the head of the department should decide who are the essential workers or not. But to me, I think right now the key area is this transport that is going on, this commercial vehicle should be stopped, this market should close, and then people concentrate on how to fight the virus. But until this is done, otherwise, your desensitization, I don't see it.
Okay, thank you very much for calling, and that's a very, I think it's a good question he asked, that this is his concern. So, Dr. Desta, what is your views on that, on what he raised, which is a genuine concern?
I think it's a genuine concern, and thank you very much for that question. And what we actually, until government takes any measure, this is up to government to whether the lockdown will be declared or not. But in the meantime, what we advise the public to do is to understand how the disease is transmitted. The disease is transmitted among close contacts, meaning that people who are close to you, wherever you are, whether you are working, whether you're on the shop, whether you're in the transport, you have to keep your distance. If you are traveling in a very congested manner, then your likelihood of getting exposed to the disease, in case there is someone in that transport, it will be very high. So people have to know the risk and try to avoid this congestion and public gathering. I see lots of people, children playing soccer, gathering together, interacting together, just like normal times, as if nothing is happening. It's like a holiday, so that's not good. Parents should understand, and guardians should understand, and those even in the public should understand this and discourage and advise children that they should not be in contact with anybody else. The best is actually to stay at home within your premises, and those who are in the marketplace, if they want to go to the marketplace, please maintain your distance. Minimum of 1 meter between each person. That's what you should maintain all the time. All the public should know this, and they should do it for their own sake and for the public. If you protect yourself, you protect others.
Yes.
If you are not infected, your family and those who are closer to you will be protected, and you also will be protected. That's how I think people should take it. But for regarding the lockdown, it will be up to the government to make a decision on that. So I won't be making any comment on that. Thank you very much.
Thank you very much, Dr. Desta. We have another caller. Hello, caller.
Hello, Vinyadi. Hello.
Yes.
Okay, I'm taking a call member.
Okay.
Comme in termu Gambian di so abe ko mol be ke min fenkilina. So ni moy min ko pola ten itana da bola ten itana ye min we min ko pola pare fa ni min ko pola for la saunal ba.
So he's asking if somebody shared cup to drink. If I drink a cup and give it to you to drink, whether that is a mode of transmission. That's what he was asking.
Okay, maybe I think you can answer him.
Okay, so coming back for Kanyame, bao ni bulo may dala, o bulo may nungala, o nyala, o be saltino na. So ndata sa sanyi be mola, na e min koponyi na tu koponyi ma ni fana ya min isa sot non. So me ya marra woto do nin sa katono pour nga kopol tla nyote mo, wolbe bete ala, wala mo nyinen jabirot.
Okay.
Okay, ala baraka bake.
Okay, baraka bake.
Okay. Okay, that's great. So I think that caller's concern, I think at the end of the day, the message I got from you is that we as individuals, we need to take responsibility for our own health.
Exactly.
So that when there is also a lockdown, I mean, it's us, we are doing it with full cooperation because we understand the reason. I think that is what I got from you. So it's good to also to keep ourselves also informed about this.
Okay.
So I wanted to ask you, Dr. Njai, I know you have been very active in setting up with the other colleagues the case management for this, and I see that your team is highly dedicated. What are the? I've also seen and have heard that people are rushing to the pharmacies to buy chloroquine, to get themselves equipped with different kinds of medication. Being in the case management field, I don't know what is your view on this?
As of now, I think WHO have not recommended any drugs to say is the treatment for this particular coronavirus. Of course, there are some studies been done about this use of chloroquine, azithromycin, and other medications, but I don't think there is still a consensus about the treatment. Of course, people are doing it. We are not advising anybody. We have seen on news that some people have even chloroquine toxicity.
Exactly.
So people have to be very, very careful about that, and we are discouraging everybody to decide from those things. If, God forbid, you have coronavirus, COVID-19, if you are diagnosed, there is a management protocol that we are going to use to help you. So we try to discourage everybody to buy medication that are not prescribed for you.
Okay.
Yes.
I think that's very useful information, Dr. Njai. So, Dr. Testa, now the contacts that are like high-risk contacts, there are not, okay, maybe let's take the caller. Yes, caller. Hello.
Assalamualaikum.
Waalaikum salam.
maa ngi rafetlu seen programme bi bu baax a baax.
jërëjëf waaw jërëjëf.
so dama bëgg a bokk ci programme bi wax comme ndax nit kuy tux comme ku ko am di tux su tuxee saxaar bi yow soo ko dookee ndax di nga ko mën a am wala doo ko mën a am. parce que nit ñi ñoom faale wuñ ñoom dañoo nekk di tux ci biir public bi te it's not safe vraiment.
waaw cigarette moom baaxut. fu ñu ko constaté mooy cigarette smoking baaxut. so ñaareel bi mooy Covid virus bi sax soo ko amee su nekkee da nga dee tux def dee gën a garaaw si yow. so ñu ngi discourage ñoo xam ne sax ñu ngi tux ñu bàyyangum ko. sakatuma soo amee coronavirus moom dafa gën a garaaw su nekkee yaa ngi tux so loolu lañ mën a advice foofu daal.
ok. kon jërëjëf loolu bëggoon naa si tam ngeen wax si bu baax tuxkat yi bu bàyyi tux yi. wala su nekkee mën nañu advice borom bi ci Moustapha mu jaay cigarette bi.
exactly
génn si feebar bi.
exactly waaw.
it's not safe.
yeah that's true.
Okay.
Thank you.
That's a very important question because he was asking about cigarette smoking. Yes, you understood. So maybe you will start speaking Wolof very soon, Dr. Desta. So, Dr. Desta, I was asking, the contacts are classified. There are some that are high risk, that have really been very close contact with the positive cases. And there are some, for example, that they've just shared, for example, a plane, a flight or so. Some of them are being managed at home. What exactly should the person that is being identified as a contact do in the home setting? Can he freely mix with everybody? Can he eat with everybody? What
Yes.
exactly? Yeah.
That's a good question. When you are a contact, it means you have been in close proximity of the person who is having the disease. So the likelihood of you getting the disease is very high.
Okay.
So if you happen to have the disease, if you have contracted the virus because of your contact, the disease, before it manifests as an illness, there is a stage where you may actually still transmit to others.
Wow.
That's why you have to be kept separated. And during that time, if you are at home, you have to isolate yourself from others within your family.
I see.
And there should be only one person who, if you need assistance, there should be only one person who would actually provide you with that support, not every family member.
Not every family
You
member.
should not accept any visitors. You should be in confinement for 14 days. If you happen to stay for 14 days and nothing develops, then that shows that you have not been infected. Now you will be released to mix with the family. Until that time, you have to be strictly away from any family member, no shaking hands, no touching with each other. Only one person in contact with you, that's what it means. home isolation means that you are doing all that. If it's not, if just staying at home, interacting with others, it doesn't help.
It doesn't help. Okay. We have a caller. Hello, caller.
Hello,
Yeah, hello.
Okay.
Uh-huh. Amin. Amin.
So, another people are going to think. So, hello?
Hello, uh-huh.
So, another people are going to
memo fala aman safe ba mo ka kaskil mo tala nyotema ni aju hana man ka coronavirus sa dul fon se sotno ko non so mbe salo wonya wala na advice ti woto ha. So he was asking whether we can share the same cast attire that we use, the small glass we use at home. So I said it's not safe because since that there is a chance of transmitting not only the COVID-19, other infections can be transmitted through that as well.
So this is like the same cup.
So,
and so même fo no woto narta bawo ni sasa be kering mo ka findi kata da mo malo nin sa be no be bo nyoko no wolbe bete ala mente momento de.
Okay.
So I think I can just add on the quarantine issue in the local languages.
Yes, please.
So même for la wolem Dr. Desla nyinka about mol ka na quarantine wala self isolation ka mo mol ba fala dol bon nan tubabulu ye ta ye samba hotel do pour ye sije ye mol men ta man ko comme sa satale bari comme ta da men do to nim men fo ise même mano je to fo malo so wala atin ka fo ko to ta si fo lokum fala ke jube bawo jamaaji ba ne sasa nyin so do lokum flo kono e bayila ko sasa nyin be findire balo bala ni sida fo lokum fla nin sasa man findi balo bala wala nyinte ko etema asoto ete stanol so be mol be dana ni ko albita ye si faye wala nyinte ko eta ini mo kana mañol bawo sa ete ba damente metla ko kala ngalo puri kana di modo la wala nga anafati ba yete ye samba isolation ini mo be kacha nyo fe wonte isolation on ni ko isolation wala nyin ini mo la hajita nyoku ne be tare fayene fajan nimba fla nyin sindo fa e be do jara falang ise bonne na fe na suko kono puri ya fe ko ye self isolation wala nyinte ko ini mo may naka haji soto je ini mo may naka blodi nyola ini mo may naka kamanyola ini mo may naka kusha ni ba kala do se mo clean sot no me alan ka be ma ko la misal fe ni after do moro na ni after kulu ha se ma ko no so mo badi ngol be dal na ni amoy ko isolation wala isolation ode ñu ngi ñuy suñ mbokki déglukat yi olof yi comme lu ñu waxtaan mooy comme isolation ñëpp dañ dee déggal lu isolation wala ñu ngi quarantaine ñeena ñi am na ñoo xam ne ñu ngi jógee bitim réew bu ñu ñëwee ñu ngi leen jël si airport bi yóbbu leen si hôtel bi pour ñu toog foofu nekkul ne ñooñu dañ feebar waaye lu ñoo sentu mooy su nekkee ne ñoom sa jël nañ feebar bu bés bu mu ñëwee loolu du feeñ so su feeñut nag yow nag soo nekkee di interact ak moom by the time feebar bi di génn mun na laa wàlla yow moo tax ñu ne gars yi dem toog benn place ba ñaari semaine te suñ demee benn place bi tam nekkul ne dañ fa war a nekk ñu dee ñuy génn ñuy waxtaan ñu toog ñuy laalante ñu def lu nekk loolu dañu war a try ñu bàyyi loolu trop loolu daf ñoo dimbale so loolu lañ la waxtaan pour affaire isolation ñëpp understand ko noonu jëlee leen jëf.
Thank you very much, Khadija. So callers, we are on. Please, we have opened the lines again. Just 5050505. We are talking about coronavirus. We are talking about current issues as it affects us currently in the Gambia. Dr. Desta, I've also noticed in the streets also a lot of people above the age of 60 walking around, you know, some of them even selling things, and even in the markets, Dr. Njai, like one of the viewers said, in the markets are full. I'm particularly concerned because it's a particular age group when they get the virus. It can be quite severe, isn't it? Just wanted you to just tell us more about that.
Yes, no, from what we have observed actually in the countries that were severely affected,
yes,
the age groups be above 40, particularly when you are actually above 50 and 60, the chance of really getting a severe form of the disease is very high.
Okay.
So people who are in that group, they should be very careful on what they do more than that others.
Okay.
But it doesn't mean that others are immune.
Exactly.
Everybody will get it if you are exposed, but the disease will be serious if your age is high, and if you have also certain other conditions that are serious.
We have a caller, but we'll come back to that very, very important point, Dr. Desta. Very well said. Hello, caller.
Hello, assalamu alaikum.
Walaikum salam.
Alda Kailato.
Kailato.
Then concern the Dr. Kani put through the benefit of the general public.
Okay.
ngamira Masakunda fana ye lu simfa lu glass sole regarding the control of the social media. Ninkura the madama is a threat worldwide. Nin social media ka tara false information o deal more every time. This is another threat in human's life. And on the social media and kajele wulu kamisake. Does the Ministry of Health or the government have any role to play regarding this?
Abaraka bake meme fala auto wala nyinti banku dingol be nyanta ka responsible le bawo ne ka kumo fo me ala ka manke to nyaati aka mol kijo farale andi mol kijo farate se kudo ke no me alon ko amanjar wala so me mol be dal na imam mel lo am ko ima ikana fo kudu ngaje le Facebook fay ko nos dol be brika me alon ka positive tale ani brika mo do ka test ke ani brika mo do ka test ke so manke to nyaati bawo brika be ka testing ke je number 1 kabinyi ndo ko starte man nos la yelo ta ka sama falan so amanke wol manke to nyaati so me mol be dal na ba ko dingol fana ka responsible demanding
yalo nimmi nyamin na people like me maybe current on social media. Okay, it's a code will be by myself.
Yes.
But there will be thousands of them, of Ghanaians, me and go, no access to know. In the information of me, I can follow the madam Maham Kedun me and go Kukudo. So I believe the health ministry or the government, at least they should take some measures on able to control the social media regarding such problems. So all of the contribution was invited.
Okay, abaraka bake. But même fala badi ngol fala mol se ke ku ka information menta. Ministry of Health luolu e ka news conference ka briefing ke mol membe ke luolu. So ni momo même mo to de wota même mo woto don wo ko bula je folo.
No problem.
Ala baraka ba.
Thank you very much for clarifying that, Dr. Njai. So, dear viewers, we will be taking a short break and we'll be back again. Or maybe we'll take a break maybe in the next 10 minutes maybe. So, yes, so Dr. Njai, can you please continue translating what he just said about the age group, the 60-year-old age group?
Okay, comment sasa nyembe alo nyamen se mo bene mutano. Bara ka men batandi bake wala molti ben mu kebaldi ka bo sanjita lula kata santola anda ka wolel batandi bake ni ajube bake fana hani men ba banta kono bake jamaaji ma wolela e jo men bo sanje dama wolle ka bata baka kono ase mobe mutano bala wolle molti so to me dani ro kala na kebal men do suwo kono men ya ko kebata ni kata ye state black lim bawo ni man finte madaj ma mo man ne kan pour ka sasa nyi soto abe kolyala pour que fantanka wala ye sabati black lim wala fente be mol yamar la men liñ doon wax mooy comme docteur Dessam noo wax ne ñum dee gën a sonal mooy mag yi ñoo xam ne dem nañ ba ëppa 50 years yooyu noonu ñoo na dee gën a sonal kon ñu ngi ñaan ñëpp suñ mag yi yu nekk si kër bi ñu try ñu toog benn place parce que soo génnut usually doo ko am su nekkee yaa ngi sa kër kenn ñëwut fa doo ko mën a am moo tax ñu ne social distancing moo tax ñu ne buñ jegeñante parce que soo jegeñul kenn yaa ngi nekk sa boor yoo kenn pour nga am ko dafaa jafe so ñu ngi ñaan kon suñu mbokk yi especially mag yu nekk si kër bi ñu try pour ñu observe loolu bu baax a baax a baax.
And I think, like he said, it's for everybody also. And I think maybe even the younger ones also, we should try our best to help the older ones. So we should, support them and try to also protect ourselves so that we don't also go out and bring it back to them while they are sitting inside the house. So this is a very, very interesting discussion we are having on COVID-19, and we're really, I think, getting a lot of very clear information on how to prevent ourselves. Dr. Desta, so regarding the also the high risk groups, I think it will be good for us to just to familiarize ourselves with them also, so that those that are fall in that category can take extra precautions. Who are the high risk groups that are actually have the severe forms?
Okay, that's good. One is age. The older you are, the highest. The most severe disease you may develop. The other important thing is also, which is related to age also, is if you are having chronic diseases like heart diseases or cardiovascular lung diseases, or something serious disease which has been with you for some time, your chance of getting severe disease is very high.
Okay.
So people have to be careful with certain conditions like diabetes, hypertension, or heart diseases or lung diseases. These are at higher risk from what we observe in other countries. So people with these conditions should be much more careful, particularly interacting with kids. I don't know, in our society it's common for young children to stay with their grandparents, which
it's
is
common here as well.
Yeah, it's very problematic, because young children, they have usually mild disease, but they would be infected, but they would transmit to the those who are elderly with some conditions. Then they can easily get a very serious disease. So that's very important. That's why we are advising, when you are in home, when, for example, if you are advised to stay home for children, they should stay in their homes. They should not interact with other children, intermingle with others around them, even with your neighbors. It should be one household together until this situation is over.
Dr. Njai, I think that's very useful information that you know we can maybe translate it.
Yes, comme men kacha kan drong ma hanisa mol men yalon ko itol pour ni sasa se batan no mol la ko fuka. Wala comme nga fanya men don kebaya comme ka kebaya nyamen sasa ni ke kutula wala nyama. Fula nya men yalon ko yin sasa bal soto ten men yalon ko ka comme to courant ka me TB men yalon ko yin asthma courant soto yele sele courant soto ni sukur courant. Wol mum molel te men yalon ko ni sasa ni mutaka wajabi bakel. So me mol dal la men yalon ko yo si fal so to se ke ku bake be ko to ni diabetic so to baramo ni baramata ka waja be nyame so nyande fan tankala wol nyame nyande fan tankala nyim fan na wol nyam so nganke ku dindingol falang ba ni nga jube say na society kono dindingol ka mamal lebul bak mamal ke fele ka kebaya so ese dindingol ya sa no ba tete sa la man fenkol bonino la bak say no bonino la bak asata sasa ninje so nani keba mata nyola sa di keba anas na batande bak oto kamalan sa kata ngani jam fa nyolo mem fo kabdim ba mal nindi mamol nindi ngol tema sa kata ngawo jam fa ni bake comme mem fo lu ñu waxte moy comme ño xamne ño la febar bi de gëna sonal moy ñan moy ño xamne dañ am yenen febar yo xamne soko amé so amé febar dina la sonal bu baax moy febari saxat moy comme TB ñu ko de waxe comme ñu am diabetes ñu am high blood ñu am asthma ñoo dañ nekk ñoo xam ne su nekkee ne feebar bi laal na leen daf leen dee gën a sonal trop so kon li ñoo ñaan mooy ñoo xam ne dañ am façon feebar yooyu nañ utu bu baax a baax ñu try ñu def précaution yu nekk di wax comme léegi xale yi da ngaa gis ne ñu ngi dëkkaa seen maam yi ñu bàyyi loolu tam xel parce que xale moom mun na am feebar bi waaye du ko sonal bu baax te su ñëwee si maam bi mun na koo jox maam bi te maam bi dina si sonal so moo tax léegi moo xam naa maam yi bugga nañ seen siti waaye foog ñu bàyyi xel si loolu léegi fuñ nekk nii.
Thank you so much, Dr. Njai. So dear viewers, we will go for a short break and then we'll be back with our other guest that we have here, Dr. Mustapha Biteye. Thank you so much. See you soon. Welcome back, viewers. We are here in the studios of QTV talking about coronavirus with me, my co-host, Dr. Masarandin Njai. And we have our other guest, like I mentioned before, the break, Dr. Mustapha Biteye, our Acting Director of Health Service, who is actually, can I say, the action man right now in this response. He's also a very busy person, but he always tries to make himself available to talk to you guys. So like we said, the lines are open 50500505. So Dr. Biteye, you know, we have cases of COVID-19 in our country. What exactly is the ministry doing, you know, to try to control the outbreak?
Well, thank you very much. So the ministry has been very busy. Initially, we were trying to ensure that it doesn't come in, you know, and now, unfortunately, we have few cases. And what that means is now we have to be more aggressive, and we have to change the operations. And the emergency center has been activated. And we have a designated team, and we are trying to beef up the numbers that are going to do the contact tracing, looking for these contacts who were with these confirmed cases, and the contacts of the contacts, some of them, and we are also doing a lot of people being isolated in different areas, so that we can watch them. I think in 5 days we will have maybe the first batch of those who are isolated to, if they don't have any symptoms, to be discharged. So a lot of work is going on the ground to try to follow up so that we can contain the disease. And some places, even a certain area will be cordoned until we can transfer them to a place where they can be quarantined.
So it seems, Dr. Njai, a lot is going on. Lots of things are going on, and you are in the case management, and I myself, I'm impressed. I've seen lots of things going on, and I think what is striking, even more striking, is the dedication of everybody. I see everybody is dedicated, and everybody is out there trying to do as much as they can. That's very good to hear, Dr. Biteye. Maybe you can translate this also for our viewers.
So I'm coming Dr. Biteye, member acting director to health service, wole nata kakafum kanja. Ya nyininka question for ko jabe nyininka forum na wala nyinti bawa fele saying sasana ta banko kan man sakunda be munake kan. Jabiro mendi wala nyinti ko follow man sakunda ba kata kan pour akana na nyim banko kan. Wala do ko be kelen o tembo be. Sa bawa fela nata banko kan saying so do kunya nyanta falinal. Wo kammale baaje la ko sayenteng sa to nyante la damento be activate na me momento sayenteng andum men ya lon ke wol fana ye men muta blakini nga fa men na quarantine dol bi je ni ala son tan telulo men kana dol be pare la ko misal fe nga men fo lokum fla ni bel je man problem soto man sa man fo mon be bula le sey foko wo say wo fana be kirin andum sayenteng mo jamaale be kiri men ya lon ko nit ñi men ye sa ñu soto ini imata ñola e be wol be ñoma kan sa yow jama ballo e kolole. So me tembol to sayenteng.
Dr. Njai, we have a caller. So hello, caller.
Hello. Abenyani.
Bejandro.
Lapa boga la program on man.
Okay, you are welcome.
Yeah, because la program is interesting tabakele.
Okay.
Yeah, mo be nyante la mo la bakele. But in terms civil servant only.
Okay.
So to la ko injakale because we are traveling to go to work. So malong masakunda be muna fala ntol civil servant la ko to. Because don't get travel and kata do ko la. So ko jakalo ni ay don faran jakal lay no because at least because kuma ko ni so be sila no so ko manta do ko la. Wala mun ni karoti no.
Maybe Dr. Biteye can comment.
So the government has given a release. There's a note out to say that in each of these agencies, in government institutions and other related places, they should scale down. That is only the essential staff should be coming to work.
I see.
And this should be determined by the head of departments. So the head of department are supposed to look, for us to be able to give the minimum necessary service, this is the number of people. If you are 20, maybe you just need 5 or 3 to be able to give that work. So you can ask all the other 17 to stay at home or to work from home, whatever is possible, and then so that the office will be decongested and the roads will be decongested, the vehicles will be decongested. So this is a way, one step the government has taken to ensure that the social distancing is also enhanced.
So coming ko lañi ila jabiro menti wala nyinti ko sayenteng masakunda be ferol ke kan ne pour be mako la nyamen ba o fengo fem fa do man nding ni ko mo be si suko no woto do l'hôpital do kula fana musibul sawno ni ko be si suko no mina problème na fela so wala at nete mo be si no suko no bal membe kelin say masakunda sa foto ke department on to pour ka jube mol tala amancho ko be bayla do ko wala nyinti ko men yalon ko be la do ko nyi hala tre man tre se kenole yewol tamba suko no do bi men yalon ko se do ko kan hani computer istano suko no do ko computer do ko tataka masakunda wala ke follow bidon ma juwelo ba kala nyaadi le nyaato bal sayenten wala ko ti men landiten so nuwo fanan ke de baaje la ko silo kambe tala mo be tala la official fanan mo be tala la ngani social distance mi fa ni 2 mila men ka fa sa mba soto non la woto me mo dal hani marché wol fanan kono ni men ka bayol wa fiten anin kutron nim fengo dol man ta bay sa wati to metem momento sainte sa nata do mor wa flal sa tuno je ni dol ni wol se ta ida hano la bitikol sono e bay la space be sot la marché ko no social distance men ka fa sa sotono ba sainte be damen hanama dingo do mor ko mata so ni nga do mor soto bay wa flal ni telephone wa flal nim fengo wole may la bitikol sono bay la ko be space sot la ñoene marché ko no ala barka.
Dr. Biteye, we are coming to the end of the program, but I want you to, give us some short a summary of what you want to, tell us, tell the public, like a short message.
So, what we want to, the important message here is that social distancing is everybody's business. So, what we are noticing is that there's reluctance. Some people are not very cooperative regarding that. So especially at the religious side, we really want people to understand that this is for the betterment of the country. Even in Mecca, in other places, they've already started observing this. So Gambia, we should understand that to do this doesn't mean that we are not very religious, we are not, but let's try our best to ensure that we reduce these gatherings. Islamic Council has come out, the Christian Council has come out to say, and they have advised. Let us follow their advice. They are the experts in that so that we can practice this. It's not for a long time, it's just for a short time. And let's not also stigmatize those who come out to be tested. So we are beginning to see that people start to run away from people. Just observe so that's why some people will react. They don't want to come out for testing, or they say, no, I don't have it. You can see a lot of theories going around saying that the people who tested are not positive. It's because we've started stigmatizing them. We should not do that.
I think before I wrap up, maybe you can just translate that, because it's a very important message.
So Dr. Biteye memang foka wala nyinti ko nga kolosiro ke koko ni social distance men ka fo len ka jamfa nyola ten mol be kede men yalan ko be balandi mbaka ko wala won fendete mi yalan ko man sakunda batanda baka nin lopitan do kulal jata kende amol yole cross mol bulu so me mol dani na bawo ya jube hani Supreme Islamic Council Christian Council be finda pour ka diamu nyin ko wala ko nga fo nyame hani makane Madina sainde ko e jamawol nyin soro na woto kamala me mol dan na fo se fero be ke ka fu nyoma nyin ko feng ay dan ro ke fanan kakal mol jube men yalon ko itara testing na pour ka problème odir bon ya jube la dol bi ni modol ta test da mol ke jube ka borila wakat da mol be ka sila comme ça hanate e sasa ta betare de le fan bun kon woto me mol dan la nga mol encourage men yalon ko symptômes so pour ene testing anu ni fan test fanan kana jube ko mu fennati me yalon ko lanjur ko le o ngaybe ko le mbala mu jata ken yala ko le.
Thank you very much, Dr. Njai. So I think from both of our viewers, it's very clear that there's lots of things being done by the Ministry of Health and by their and the partners. Lots of things are being done, but if the public doesn't cooperate and do also their part, we will also we will not be able to do much. So it's the appeal to the public is that please follow the advice that's been given by the Ministry of Health. Wash your hands, stay at home, practice social distancing or physical distancing as it is now called. At least be 1 meter away from the next person. Thank you very much, dear viewers, and we'll be back again next time with another Health Link program. Thank you. Thank you, Dr. Njai.
Thank you.
And Dr. Biteye. Thank you so much.